Hello, and welcome back to Authentically Shawna with your host, Dr. Shawna Berk. If you tuned into episode 1, you got to hear a brief history of my life up until 29 years old. Then I kind of cliffhanged you and said, there was this really big event. I was in a car accident and it changed my life. So, ta-da! Here's episode 2 talking about said event. So, I wanted to repeat what I heard Dave Asprey say. I heard him talk at a longevity conference this past April, and he said something that really resonated was he had been really ill in his 20s and had a lot of symptoms, which I highly recommend listening to his podcast, and his books are great. He had said, I felt like a very old person, even though my age was not. How I felt and my age were not a match. And he's been on a journey to essentially age backwards, right? If he felt like an elderly person, to age even younger than what his actual age is. And so I feel really akin in that sense. Yeah, I feel like for the past 7, almost 8 years, I have felt very old. I felt like my body has not been the body of someone in their 30s, and it has been a very difficult journey just within physical space. And then on top of that, like the mental with graduate school. And then on top of that, like a really big spiritual component. So I feel like it's been a very challenging 7 years, and I've learned so many lessons, and I really had so many blessings in this time. Again, not that I know Dave Asprey personally, but I think, we share the same sentiment. And there was something like pretty terrible that happened. And now I have all these tools and I have all these insights. And like, how do I share that with the world? And then how do I continue to help other people and teach other people, not necessarily on a one-on-one level, but how do I get this information that I've acquired and help spread it? Because there's so much good information, there's so much help in the world, and it's just not out there. I think it's way more out there than it was 7 years ago. But if you're in the right circles, but if you're not and you haven't found your way, this world, I'll call it like a more holistic, total body approach, then like you don't know what to do. And that's exactly the place that I found myself in 7 years ago. I was in a T-bone car accident. I was driving on my way to my last prerequisite course, a biology course, in order to be able to apply to Cal State Long Beach's doctor physical therapy program, which turned to work out in my favor because I got into that program. So I was driving to school and saw it happening. I saw the driver. She was in a little intersection and I was slowing down and she didn't see me and she drove straight into my driver door. It's really hard to explain because I kind of knew everything like changed in an instant and couldn't quite grasp what had changed. I knew that things weren't right, and I wasn't even sure what my symptoms were and what it meant and who to go see and what to do. And so I started reaching out to practitioners that I already knew. I reached out to my pelvic floor physical therapist. I reached out to my Pilates instructor. And so I sort of created my own network of practitioners who I didn't have a lot of symptoms prior to the accident. And one thing that I've heard from several practitioners, and this really resonates, is that our body has had a lot of injury, a lot of sickness. Our body can tolerate so much until it can't. So all of these structural things that I've been having a hard time with, my immune system, my gut health, all of those things were underlying. They just got exacerbated to the point where my body couldn't compensate for these things anymore. And then it was just like this kind of storm of symptoms and not really knowing what to do with them or how to heal from them, what even they were. And so a lot of the first, I'm going to say couple of months was just figuring out what's going on because I felt awful. Like I was having a really hard time just pulling myself out of bed. Like I felt like I was wearing weights, like weighted vests, but like times 10 and all over my body. Like I felt so heavy. Everything hurt. Like it was hard to open my eyelids. And I had gone to my primary care physician and she sent me to get x-rays and she didn't like how my neck looked. And so she sent me to get a CT scan. She cleared. There was like nothing, we're going to say major. It was some strain and sprain. the ligaments in my cervical spine and was basically told like, you'll just get better. And I was also told that I had a mild concussion likely, but that those symptoms would go away, and they just didn't. So then you go, okay, so who do I see? What do I get tested? Like, I don't really know what to do. And also, was in a place of I don't know how much to do. And I think that's another really big thing as well, is like, do I rest? Do I move? What do I luckily had my Pilates instructor, Corinne, who like I have to give her so much kudos and credit because she really, really taught me how to move again. So I'm not sure which caused this per se. So that's sort of unclear, but I know that we have movement tracks in our brain. And I think like if you are thinking of brain injury, I think stroke is a really great example. And I think I had that to a minor degree, not a stroke, but that same there. So what happens is when you have something happen on one side of your brain, it affects your movement on the opposite side of the brain. So I had a knock from the way that I torsioned on the right side of my brain. And so I had a hard time moving on the left side of my body. Like if you asked me, Shawna, put your right leg behind you, I would say, great, no problem. I can do that. If you asked me to do that on my left, I didn't have any memory of how to do that, which is really scary. Let me tell you, when you can't figure out how to move, you just kind of guess. So like all of the movements on the left side of my body were just guesses. I was just guessing that was right because I had no understanding where I was in space on the left side of my body. And also knew that something wasn't quite right because my digestive system was really off. And so I've learned a lot about the gut-brain axis. And again, traumatic brain injury impacts your gut. Your gut also impacts your immune system. So I started working with Dr. Howard Cohn at the Cohn Center. And I always appreciate someone's honesty. But when I first came in, he's like, wow, you look rough. Like I've seen people who've flown through windshields who look better than you do. Like I knew I felt bad. And him saying that actually made me feel so much better because I was like, maybe I'm making this up. Like maybe I'm not this bad. Maybe I'm just catastrophizing this in my head. And he was really helpful in like just getting my body to process the trauma. And then he passed me over to his wife, who also works in the practice, Dr. Christine Cohn. I'm so grateful that I was then under her care and we started really helping my immune system because essentially I was just sick. Like our body keeps tabs of all the viruses, bacteria, pathogens that we've seen, and I was just flooded with all of them. And yeah, I felt just awful. And so she was working on that portion of it and then also really great in emotion aspect of it, which I was pretty eye rolly about that at first, was like, I'm not that emotional. Like, why would I need to work on my emotions? Like, it's my physical body that doesn't feel good. Like, how could that be attached to my emotions? And yeah, wow, I was definitely wrong about that. I've had a lot of lessons in that, I can say, in how emotions show up in our body. I mean, I think we kind of hit on it a little bit in society, right? You have butterflies in your stomach, which, you're nervous and that's just like a way you feel it is in your stomach. Like, I think we sort of have these sayings, but I had never really put that together for myself. And so I definitely got a really big life lesson in that as well. Something that I also really learned from Dr. Christine was to get someone to the next person who can help them. So because of the impact injury, the bones on the left side of my face got torsioned. And at a certain point, she was like, your face is really messed up and like, I can't help. So I'm going to send you to someone who specializes in that. And that was such a blessing in the fact that I got to work with this other practitioner, but just like I think it gave me then permission to know as someone who was going to be a practitioner that like I didn't have to have all the answers. And if I didn't know something, like I could always help someone find the next right person. And that was so relieving to me. Like I felt so much relief knowing I didn't have to be everyone's person and that like an exceptional practitioner will tell you when their skill set is when you've like outmatched their skill set and that you need to see someone else. You can get like I still continue seeing her for the things that she was helping me through. But I then also started seeing Dr. Curtis Budding, who passed a couple Januaries ago, but he did a technique called sacro-occipital technique, which really focused on the cranium and its relation to the rest of the body. And I'm going to have another episode about his wife, Mickey. More on that later. But I was seeing a combination of people in this interim between the car accident, and I had found out during this process that I got into grad school and I got into Cal State Long Beach, which I was so happy about. And I felt like there was this big finish line that I was trying to get to. Like, if I can just get better, quote unquote, like grad school will be fine. And I would say the first about 6 months, I was in a lot of pain along my spine, and it would shift and change. And I would go see someone, and your cranium and your pelvis and your sacrum are like the same system, they're just opposite ends. And so I felt like my cranium and neck would really be bothering me. And then we'd work on it, and then my sacrum would really hurt. And then I'd go see someone and we work on my sacrum, and then my cranium and head would really hurt. It was just like this back and forth teeter-totter game. And it sort of felt like, oh, when am I going to get off this cycle of transferring from one part of the body to the next? And so I would say probably about April that I was in a lot less overall body pain and had more endurance. And, I had taken that biology class and had finished it. And I was really lucky that I had an old school professor and that like there was no slideshows. Nothing was fancy. He wrote the outline on the board. So I didn't really have to challenge my visual system very much. Grad school comes and I have this feeling that like I can't drive myself to school. Like it's just too much, which again, my parents, and I was living with my parents, was 2 miles away. And like, thank goodness for my parents. My parents are wonderful, and I couldn't have done that period without them. And I'll talk about that as well in present moment but did not have the capacity to really take care of myself. I could get up and go to work for a few hours. I was substitute teaching. I could go to class, but then like I didn't have like the capacity or the bandwidth to like do chores, cook, clean, laundry. Like I didn't have it in me. And so my parents were so helpful in that regard. And then I started grad school in May. And luckily I have an amazing classmate, Taylor, which he'll be on the podcast. He would come and pick me up every day and drive me to grad school. Cause I like the thought of having to drive myself and park, because parking was nutty on campus, like that just was like more than I knew I could tolerate. And then I would take the public bus home because I didn't have the capacity to get in a car and drive myself. I don't think I could have like admitted that out loud to myself. And I think it has taken me a long time to like get perspective on that. But it was just, I was like at capacity, and grad school started and it did not go well. And I guess I would say that I was really blessed that the program I was in really messed up. I would say they kind of threw all of us over an academic cliff. And so half of us failed the first anatomy exam, and I was definitely one of them. And I knew something wasn't right. Like I was like, my brain isn't right. Like I can't process what's happening. And while I had taken a few other continuing education classes, continuing courses that I needed to get into the program, and I'd done so well and felt like, wow, like I'm in the best academic stride of my life. Undergrad was rough. I just knew something wasn't right. Like something's up. And I was having panic attacks. So I was waking up in the middle of the night, like, yeah, panicking. And my mom would come into my room and like hold me as I was like sobbing about school. And like, I was like, this isn't me. I don't know how to say it, but like, this isn't me. And I don't know what's happening. And so I was also taking neuroanatomy at that time. And my neuro professor had office hours. And so I went to her office hours, and she specialized in students on campus, athletes who had concussions, and helping them get back to school. And so I thought, well, I mean, she knows better than anyone how to work with concussion and school. And I went to her office and I said, hey, I was in a car accident 8 months ago. I just don't feel like myself. I just feel like my brain isn't processing well. I'm having panic attacks. And she's like, well, it sounds like you're stressed and grad school is really hard. So like, you either get it together or there's the door. And I was like, wow, okay, that was completely unhelpful. Yeah. I was like, okay, so she thinks I'm making this up and she's not the person to help me. Okay, lesson learned. And so luckily I had an appointment with Dr. Christine, and I was like, something's not right. And she's someone who also knows a lot about neurology, functional neurology. And she did some testing on me. And what we discovered was that some of the letters of the alphabet, I was flipping them in my brain. And so as soon as I got to one of those letters, my brain would kind of shut off for a second because it would flip it. And then I'd come back online, but then I'd hit another letter that I couldn't process and I'd come back. So like I wasn't processing information because my brain kept turning on and off. And we got that flip switched. And it was like instantly I could read again. And I was like, wow, I I I guess like the really big blessing of grad school was that I just don't think I would have known. I think it would have just been like, oh well, maybe I'm getting older. Like I was 29 or 30. Um, like maybe like maybe I just like am tired of reading. Like I think I would have written it off, but grad school really made me come to terms with what was going on with my brain. And I like all of my classmates would tell you that graduate school is hard. Like no one would be like, "Oh, that was a really easy time in my life." Like everyone is stressed to the max. Our program, I would say, was probably one of the more challenging programs in terms of mentality. It felt like our program's mentality was, it was hard for us, so it has to be hard for you. And so it just felt like they did things that were unnecessarily hard and challenging because that's what they had to go through and what other students had to go through. So like we had to go through it as well. It was like I don't quite understand like why this is the mentality that we're having. Like we're training doctors who we want to be compassionate towards other humans, but like that same idea isn't being given to us. And it was, yeah, I truly don't know how I did it. I think my brain figured out ways to compensate. Like I had mentioned in the first episode, I used an app called Notability. So our professors would email us the PDFs and I download the PDF into this app and then I could record their voice over the slides and then I would go and write myself notes. So I listened to almost every lecture that I had twice and then would write myself notes. And I think that's really how I did it as I used a lot of my auditory skills because my visual processing system was not great. I found out like my second summer of grad school that I had resting nystagmus, which is basically an indicator that you've had a brain injury. And I knew that because I went to put on my glasses one day and like the world was swimming. I'm like, okay, something isn't right. So I go to the optometrist thinking like, oh, they'll give me a change of prescription. And they said, we can't even change your prescription because you have such bad nystagmus that like you don't have a prescription at the moment. So I kind of just was like, well, I guess I'm not using glasses. Like I guess I'm just gonna make it up as I go. So I had a history of visual, we'll say, impairment as a kid. And again, I think when you have a big injury, it just taxes all the systems that already aren't as strong. So I feel like I learned how to cope and tolerate through everything, but like to the detriment of my nervous system. I mean, I think all of us were in like fight or flight to an extreme. And like if you ask me like, did my body hurt during grad school? I'm sure it did. I couldn't process it. Like I have no like recollection of being in pain. I just knew that if I didn't study every waking minute that I had, that I couldn't keep up. And it was honestly just one of the uh, people in the course above us had said something like, you just learn to die another day. Like, not every day is going to be great. And you just learn to get through the day. And our program had an 80% basically rule. We'll say like you had to maintain 80%. So you had to maintain a B average to stay in the program. And I was just like, okay, like some days are going to be great and some classes I'm going to really do great at and some classes I'm not. And like at the end of the day, like as long as I can keep an 80 average, I'm here. And I did. Again, my parents helped me so much. All I did was school. That's all I could tolerate. And I I'm really glad that I did it. And I had asked my practitioners, especially Dr. Budding and Dr. Christine at the time, it was like, can I tolerate this? Like, is this a bad idea for me to be doing? Am I hurting myself by not taking a year off, like by not pausing for a year? Do I need to pause? Like, and they were like, no, like just do it. you've got this. We're here to support you. You just need to do it. Like, grad school is a slog and you just have to get through it. And so I did. And um, I graduated in May 2021, and the whole pandemic and blah, 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 blah. Like, that's a whole other spiel about what like went on during that time. But as a student, and that was wild. But I graduated and then studied for my board exam and took the board exam in August and failed it by one question, which was just like devastating because I just wanted to be done. Like, I just wanted to be done studying. I was like, I have to study again for the this test that like truly like has nothing to do with practice. I know that they think that they're writing a test and has to do with practice, but like there is some, yeah, it felt like it had nothing to do with me being a practitioner or the way that I wanted to practice. Maybe that's what I should say. And so I studied again, and I think I took it in October. And again, I failed it by one question. I was like, okay, like once, understandable. Twice, like, okay, there's probably a lot deeper I need to get with myself, and like I need to get right with myself because something isn't right. Like I'm holding myself back from succeeding. And I think that that's a really big lesson in my life that I like continue to learn and continue to come up against is I think a lot of people have a fear of failure. And I've failed at so many things so many times. And I just like don't really fear failure at this point. I think I fear success. I know that I do. I know that I've been told that by multiple people in multiple instances. And if I pass this test, right, then I have to actually practice. And like, well, what if I'm not good? And how do I actually do this thing called practicing physical therapy? And for me, I think there was a lot of, again, that mental, emotional component that I just wasn't addressing. I was just studying, and I had gotten good at just studying. Like, that was who my personality was for 3 years, was I just study. And I really had to come to terms with who am I and who do I want to be and how do I want to be? And I knew I had wanted to do a lot of more holistic practices in my practice. And I just took that year to take a lot of classes in things that I was really interested in. And I met a lot of people who have really helped shape and influence who I am to this day. And because my body was running on adrenaline for 3 years, I didn't even quite know how to process everything else that was going on in my body. Because I think at a certain point, like once I started grad school, everything just paused. And in my brain, everything had just gotten better, which it hadn't. Again, your body only has so much bandwidth, and my bandwidth was school. And so a lot of things after like a year after, and I took the board exam again and passed by quite a bit. I started to have a lot more health challenges. I went through a phase of having a parasite overload and then a yeast overload, and I kept having back pain. I had not done a lot of chores or been helpful around the house, and I was starting to get to a place where I had more energy, although like parasites are really draining, so I didn't have any energy again, and yeast really draining again. So it was like, is this because my back hurts? Is this because I'm having this like kind of systemic issues going on? Like, what's the root of all of this? And I pretty quickly realized that my spine, there was something going on with my spine. And so this is like 2022. And yeah, I just kept being like, it's hurting to like put away dishes, to cut when I'm cooking, like simple basic things that like normally don't bring on pain are bringing on pain. Okay, like, is it my technique? Like, is it the way I'm standing? Like in school, we talk a lot about if you're going to do manual therapy, what's your posturing? Are you doing it in a way that's sustainable? And so I was really trying to hone in and like, how do I make my posturing better? And nothing was helping. And so I started seeking help from other techniques and other doctors. Like, I'd go to a training and I'd talk to the expert in that technique and say like, hey, my back hurts. And then he'd work on me and it didn't help. And then I'd go see the next person. So I kind of was like bouncing around a lot. And I was getting to a point where I was, let's say, getting kind of told, I should take out the word kind of, I was getting told that it was in my head, that I had chronic pain, and that like that my body was okay, but because I had pain, now for so long, even though like I don't really remember having pain for several years, although I don't really remember anything outside of school for several years, that like this was just how it was now. Like I kept getting told by people like you seem really stressed. Like it's a lot of your emotions. Like you need to process more of your emotions. And I'm like, okay, like I'll keep processing my emotions, but like something feels off. Like again, that like little voice in my head that's like something's not right, Shawna. And I had met a friend who is Canadian and is an acupuncturist, and was like, I think you should try this technique. Like I've heard it's helped a lot of people with injury, and that's the technique that I'm up in Canada learning round 2 and getting treated by the creator, Dr. George Ross. And she was like, I think this is a technique that you really need to explore. I think it will help. And I guess I should like rewind a little bit. So I passed my board exams, and my plan is to start my own practice right away. And the wall or barrier that I keep running into is nobody knows me, nobody knows who I am, and I'm trying to do this like more holistic, alternative physical therapy, but nobody knows me. And other people who kind of do this like more holistic approach, like don't take insurance or cash pay, have their own clinic. The problem is that none of these people who are also doing this like want to hire anyone. And because they're solopreneurs and they like being solopreneurs, and they've started their own practice and clinic because they don't want to have any employees. And so I just kept running into this problem, kind of like when I graduated from chemistry. I was like, nobody wants to hire you. I can't tolerate the workload in a regular clinic setting. So like the way it works in most clinics right now, at least people that I know, is you, as the clinician, as the doctor of physical therapy, you basically are just doing manual therapy almost the whole day and notes. And then you're transferring the more movement and exercise interventions onto an aide. And I was like, and I had experienced that in my rotations. And I'm like, I just don't think I can handle doing manual therapy for 8 hours. Like, I don't have that bandwidth and the amount of paperwork. Like, I can't practice like that. So like, what do I do? Like, how do I exist? How do I practice? And I'm like trying my own things and they're not working. And I'm like trying to do this work at this like holistic space in Long Beach, and nobody's calling. And, it's just like, okay, so I'm failing at this. So I need to start making money. And how do I do that? And so a job through a company that does like quote unquote outpatient orthopedic. So it would be comparable to what happens in an outpatient orthopedic clinic, but in people's homes. And it allows me the freedom to not do manual therapy. So I basically, and I'm still doing this job to this day, I would say almost 100% of my intervention is exercise intervention. And because I learned so much from working with Corinne and through school as well, but I would say a lot of my learning came through her, is I'm exceptional at teaching people how to move differently. And I would say most of my patients get better because I'm teaching them how to move differently. Now they're doing the work. They're absolutely putting in the effort. I want to be very clear that my belief is that I don't heal anyone. You heal yourself. The person who you're seeing is giving you the tools to do the healing. And I have amazing success with doing exercise intervention. And I know that I'm successful because people will tell me, oh, I've had lots of physical therapy before, and you're the best therapist I've ever worked with. And I'm not saying that to be like, I'm so good. I'm just saying, like, I know that me doing only exercise intervention is potent, and that's great. And the hard part about like not working, I'm an independent contractor, so I'm never guaranteed work, and people can cancel. And, how do you make a living doing this? So I have a second job. I work at a clinic, no, at a gym. Uh, and I personal train because, again, I get to do exercise intervention, and I actually really like that because I get to take all of my expertise as a doctor, and I get to look at the whole body, which is not how the insurance model works. I get to look at the whole body. I get to help people who've had multiple injuries and help them create a way to move and move successfully. And I'll get into more of that later because I think that's the next direction I'm heading, and I like can't wait to share more of that. But I kept having this like inner knowing that I don't have the physical capacity to like do a quote unquote manual therapy job all day. And so I take this course called Matrix Repatterning in March, and I come in a couple of days early and work with the creator of the technique, Dr. George Ross. And I'm like, I keep having back pain. Like I don't know what to do at this point. Like, I feel like I've tried everything. I've tried all the interventions I know. I've tried exercise. I've tried not exercise. I've tried to stretch. I've tried to not stretch. I've tried, like, you name an intervention. I've tried chiropractic. I've tried massage. I've tried acupuncture. Like, I've tried all the things. I'm not giving up. I haven't found the right thing yet. And he looks at my spine, palpates, which is like touches down the sides of my spine. And it's like, I think you have a scoliosis from where the car, like the impact that you took on the car. And I was like, what? Like, I couldn't quite believe what he was saying, because I feel like I've seen so many people and so many people have palpated and looked at my spine. And I was like, how, like, for 7 years, like, how has no one picked up on this? And I think that it's probably like a litany of reasons, but I just don't think that I was ready to deal with it. Like, I wasn't ready to heal my spine because I didn't have the bandwidth. My nervous system was like in so much running. I just didn't have the space or capacity to heal my spine. And so for the past year prior to this, I've been seeing a friend of mine who just specializes in nervous system chiropractic. And I've seen a lot of change in myself. And I know that my nervous system is really healing and changing because of that. And I I think that I like, and this is March 2024, that I like was finally able to process what is happening in my spine. And so I come home and he's like, I want you to get x-rays. And so I find a local chiropractor and I get x-rays and I see my spine, because it had literally never occurred to me to get an x-ray. Like, I know it probably sounds crazy. Like, I help people all the time. And um, I don't know. I think we have this mentality, which I don't think it's a bad thing, but we have this mentality right now in current practice, at least in physical therapy, where it's like imaging doesn't really tell you much. It doesn't really tell you the whole story, which I agree in a lot of cases. But I think in my case, it tells you a lot. And no one had thought to have me have an x-ray. Like, I hadn't thought, because I couldn't perceive that something was going on in my spine. And so I get the x-ray and I look at it, and like the first thought that pops into my brain is, that is not a body that can tolerate getting pregnant. So you might be thinking to yourself, Shawna, like, I didn't know you wanted to get pregnant. Like, you're dating someone, like, you have a partner. Like, no. That was like a trapdoor in my brain that was like covered by a rug and had a table over it. Like, I didn't even know the trapdoor was there. And it like fell through, and I fell through with it and was like, wow, okay. Like, I knew that I had wanted that, but I didn't realize how much I have been holding myself back from even having partnership because of the way that I feel. And I looked at that x-ray and went like, okay, I have somewhere to go now. Like, I know that my spine can heal. Like, I have 100% confidence that my spine will heal and that I will be able to have a baby. I didn't even know that that was the goal that I was going for. Like, I don't know how to say this because I'm probably repeating myself, but I didn't even know that that was a goal for me to have. And so I think, like, in a very personal part of my life, I have not wanted to date or to be in a romantic relationship because I just haven't felt really well. And I haven't wanted to meet someone while I feel like I'm not at capacity. And I'm just so ready for partnership for myself. Like, I'm so ready to be there. And in my mental space and in my like manifestations, I am there. And I'm like waiting and willing and praying that my body is going to catch up soon. And I think for me, there's this big guilt that comes. I want to make sure that when I meet my partner, I can like very confidently tell them, like, my body can tolerate having a baby. Now, whether or not I get pregnant or not, I don't know, right? Like, there's no guarantees in life, but I want to be really confident, like, that I can tolerate having a baby. And right now, that's not true. And I don't want to lead someone on. And I also just don't have capacity to do life skills at the moment, which, again, like, this is not the sexy, fun part to talk about, but like, I still need help with ADLs. Like, doing dishes and cooking and cleaning are still something that like I can't do. It really hurts. And I'm hoping, like, my prayer and my desire and wish is that that will end really soon. Like, I'm hoping I feel so much better at the end, the next like 6 days that I'm here. And I'm not there. That feels really embarrassing to me to be 36 and to need help with activities of daily living. And I haven't told a lot of people, like, I'm spilling the beans on my podcast. But it's not something that a lot of people know about me. I don't talk about this. Like, if you've been following me on Instagram, like I just started sharing about this because it felt like it was time to start. But before I don't even think I could put the pieces together for myself of like what was actually happening. And I don't think I wanted to put those pieces together, I think is the probably very honest part of that. And I feel like I'm ready to accept those pieces of myself. And I am so looking forward to my spine being healed and for my body to be healed. And I know it's possible, and I'm working with people who believe it's possible. And if I could give any words of wisdom, it's like find people who believe that that like what you have is not cataclysmic, right? It's not like, oh my gosh, I've never seen that before. I don't even know if you would get better. Like I'm working with people who are like, you will get better. Like we're going to get you there. And yeah, that's the place that I'm at the moment. I am like right on the precipice, and this is so vulnerable for me to share because I love when people tell their stories and like they're so far on the other side of it, like they've come through it and I haven't come through it yet, and I just feel like it's time for me to share, even though I don't have like a really pretty bow or ribbon to put on this story quite yet. I don't often hear people tell their story while they're still like in a big process of it. Like I think a lot of times people have these big events happen and they wrap it up and they've moved on to the next version of them, and then they're telling this other version. And um yeah, it felt like the timing was really fortuitous for me to start talking even before my story has wrapped. So I'm going to end there, and I'm going to sponsor myself. I have no sponsors for my podcast yet, but if you are wanting to support the podcast, you can do that by DMing me hair quiz on Instagram at Dr. Shawna Berk, which is at DrShawnaBerk. I am working with Monat, Monat. They are mainly a hair care, but also a skincare line. I've been using their products now for a couple of months, and I have naturally wavy hair, and just from all of the health issues that I've been having, my hair has not been great. It's been like just kind of limp and it lost its wave. And I can say my wave is back. My hair feels like bouncy and light, and I'm just loving the way these products are feeling in my hair. I'm taking a step back to my like 20s when I worked at Second Street Beauty, which no longer exists, helping people shampoo. So I'm taking a step back in time. So if you would like to change up your hair care routine, I would love to help you. I'll send you a hair quiz, help you figure out the products that would be the best for you. And thanks so much for listening. You are listening to Authentically Shawna with Dr. Shawna Berk. The information contained in this podcast is provided for information purposes only and is not intended for the purpose of diagnosing, treating, curing, or preventing any disease. Before using any products or techniques referred to in this podcast, consult your healthcare provider. Individuals on this podcast may have direct or indirect financial interest in products or services referred to